Colin Murphy, founder, CEO of OpenXMed, a revolutionary program that's being launched right here in Alberta. You're trying to bring a lot of existing documentation or future documentation into a more practical set. And then on top of that, kind of the dual purposing as well is having the physicians have access to that so that they can apply it to practical medicine. So can you tell us, like, since you were last here, I mean, there's been some movement and kind of shift in the environmental area of the medical industry. Can you kind of tell us how things have been going and how the journey's been going so far for you?
Yeah, absolutely, Bryce. So, you know, one of our key objectives was to get traction within Alberta Health Services. So actually we found out about this AHS Innovation Group, so AHS being short for Alberta Health Services.
You betcha.
So they've been phenomenal, honestly, at connecting us with people in the ecosystem. As you can imagine, AHS is a huge organization. They're one of the top employers in Alberta, and they service 4.3 million citizens of Alberta. And so navigating through that whole, you know, those layers can be a challenge for not only the patients, but for anyone who wants to innovate within Alberta and healthcare. And so that tool is, I would really encourage people who are interested in healthcare to reach out to them. They've been extremely supportive in terms of bridging connections for us within AHS. So since then, we've had high-level meetings with the strategic clinical networks. So essentially, the strategic clinical networks, there's 14 in the province. They are like the thought leaders, if you will, for different diseases. So you have heart and stroke, you have your primary care, you have your diabetes, nutrition and obesity, you have your lungs. So they have kind of thought leaders in each of those areas. And so they're the ones who provide recommendations to the operational side of Alberta Health Services in terms of what they think that should be done. And so getting connected with them is just a huge thing. So just as of today, I got off the phone with one of their senior provincial directors, and she is going to arrange a meeting for us to meet again with these people. And yeah, I feel from that perspective, we're starting to get really good traction and kind of get our bearings within the organization. So,
right. Yeah. And the potential future of that is getting OpenXMed to be implemented a little bit more exposure for OpenXMed to get out there to, you know, frontline physicians, so they have access to this program and they see the value in it as well. Correct?
That's exactly it. So, you know, one of the key things here is integration. So, you know, you have specialist care, where, you know, if you have a stroke, you know, you're going to go see the neurologist and they're going to look after you. But then equally important, if not more important, is primary care, where those are your family physicians who are seeing you in your medical home. They're essentially like the quarterbacks or the point people within the healthcare system. And having good continuity of care is extremely important.
For sure.
Healthcare systems increasingly are trying to shift care delivery from, you know, being exclusively at that specialist care level to also involving primary care, because it improves access for the patient. You know, it's closer to home, but also it's, you know, less expensive than having those patients admitted to hospital. And also it helps to, studies have shown it helps to improve quality of care delivery. So that's really where OpenXMed, our platform, is positioned to help primary care physicians deliver high quality care, you know, kind of linking knowledge and information about the patient into that decision point of care, but then connecting it.
Inefficiency and speed, right?
Inefficiency and speed.
Right. So just making sure that, you know, well, having that come a lot faster to your physician for to diagnose, like we were talking earlier, like say it's a tumor, or especially when we get into heart and lungs, if there's the algorithms, like you were saying, you can build up in the program to help you get to a quicker decision, a better informed decision, to a better solution, a quicker solution, helps that patient so much faster.
Totally. Like, I don't know how they do it, the primary care docs, but they have such a broad scope of knowledge that they need, you know. They have 2 years of training, and they have to keep on top of all this stuff. And they see everything under the sun, right?
So the body's so complex.
The body is so complex.
So many elements.
So we feel they need better tools. They need better data at point of care to help them. And like you said, they only have that 12-minute window in which to see those patients. So it has to be done efficiently.
Yes.
So yeah.
And so now, right now, when it comes to content for the program, for people to have access for the information, you've had hundreds of people applying and submitting already. You've got a few now. I think you were saying 20 here in Alberta now. That's right. That are supplying for the content. What's that kind of process been going like for you? What do you need to get more people to get involved? What's kind of the next steps to get this program to get to the next level?
Yeah, great question. So on our side, we're trying to build the infrastructure. Actually, we've built it, essentially the onboarding, so that when these physicians come onto the platform, they kind of understand how to create an interactive algorithm. Like, that's the fundamental basis of our platform.
Gotcha.
And essentially we have like a, not to get too technical, but we have end user programming, so that instead of a physician having to tell a programmer, hey, listen, I want you to create this interactive algorithm, they can do it themselves. So we've created that tool for them to be able to do it.
Gotcha.
But now we have to show them how it works. So we finished that piece, and so we're just ramping up now to get those people on board. And what we're focused on is the top 20 diseases, that kind of overlap in terms of cost to the healthcare system, in terms of what are common diseases, complex diseases that these primary care physicians see, and where can we really help to build quality for these big diseases within the province. So we're trying to get content for those 20 algorithms. Now, that being said, there is work that's already been done within the province, so we don't want to duplicate it. We want to be complementary to the hard work that's been done within the ecosystem of Alberta. So, these SCNs that I told you about, they've already done some of this pathway work, so we want to integrate some of that into what we're doing, and that's what these upcoming discussions are for. And
there's big opportunities out there. And you were mentioning earlier in regards to like senior care, and again cardiology and heart care. Can you talk about some of those opportunities and some of the doors that might be available to be opened for you to kind of get into those areas and assist there with this kind of this implementation of this program?
Yeah, absolutely. So, I met with dinner with Reg Joseph, who is CEO of Health City. They've been extremely supportive in terms of the work that we've done, and in fact, they had us present in front of the steering committee, which is made up of members such as Dynalife and so forth. And anyways, one of the projects Reg is working on is exactly that, to deal with seniors.
Gotcha.
So they have a whole bunch of data in terms of the, kind of like social programs that have been delivered for these seniors. But what they'd like to do is link that social data with medical data to be able to identify those seniors who are at high risk of these conditions, and maybe they can be targeted through, say, a platform like ours, to give specific recommendations to that primary care physician who's seeing them. So it's that linking of the data that is going to be extremely powerful in the province. And the thing is, Bryce, the province, as you know, is so well positioned because of, they've invested a lot of money in terms of building IT infrastructure for all 4.3 million citizens. A lot of provinces don't have this. And I think we're going to be leaders in terms of this kind of thing in the next 10 years.
And again, it just goes to when you start sharing that data and linking those, making those connections to speed up. So in the event of something that does come up with a patient, we can identify it quickly. We are on the right path. We're not guessing anymore. We're like, well, it might be that, it might be this. You got that instant connection with people that all have seen something, or somebody has seen something similar to that. They know what the solution is, or they have like the latest and up-to-date data on what the research has been on that particular, again, like it is, if it's something in the heart or something in the lungs, we know it right off the bat. We get it done. So that's super, super awesome.
Yeah, that's exactly it. So let me take it down to a concrete example. So you have your, 50-year-old male from, let's say, some rural primary care network. They've had a heart attack, and as a result, they've lost like half of their heart function. So they're having this issue with heart failure, which means you're collecting fluid on the lungs, you can't breathe, and so there's the medical piece of that. So how well is their heart working? What caused their heart attack in the first place, and those can be treated with medication. But then there's the other piece, which are what are the determinants that are going to kind of impact that fellow's outcome in the next 10 years, like his ability to get back into the workforce and be a citizen who's able to work again. And so factors, and it's amazing actually, if you look at the social determinants of health, if you're, if he was separated, he's divorced, that would automatically double his risk of being hospitalized with heart failure, or if he, if he had a certain socioeconomic status, maybe, because of the heart attack, he's out of a job, he worked in the oil field previously, now he can't pay, for gas to be able to drive to the heart function clinic in Red Deer Hospital. These are all like real determinants of how well is this individual going to do, over the next 10 years or what have you. And so it's really important when that primary care physician is making these decisions that he or she is able to sort of incorporate both that medical aspect, but also the social determinants of health.
It's an informed decision.
Yeah, an informed
they're
decision.
up to date on everything. That's a
Exactly.
potential catalyst, right? So,
exactly.
Right on.
Yeah.
So now when we go into just kind of the support with the program, what are some areas, I kind of mentioned this earlier just for opportunities, but we were talking about like infrastructure with technology and getting the program out there. You mentioned a little bit off camera just in regards to getting connected with TELUS and trying to get the platform set so they can accept the kind of program so it can be disseminated out to physicians that want to use it. Can you talk a little bit to that? Yeah,
definitely. So probably a lot of people aren't aware, but we have this system coming into the province called Connect Care, which is going to service the hospitals. So it's kind of like the acute care platform. And they will also service ambulatory care, I should mention, so like the specialty clinics. But then there's a separate group of systems that are for primary care. So that's TELUS. TELUS has 80% of the market share of these systems. Way back when, 10 years ago, they bought the majority of the systems in Canada. I think that was a smart business move on their part. But the thing is, we need that integration between the information locked up in the hospitals to the information locked up in primary care, and the information that is siloed in these different areas, such as, we talked about the seniors data for social programs. And so it's really when we can start to integrate all this data that we're going to really start to recognize patterns, really be able to help people, based on that data. And so that's one of the things we're trying to do with OpenX Med. We're part of this Hatch program. It's based out of Calgary. It was founded by Rohit Joshi, an entrepreneur who's fantastic. He developed a platform called BrightSquid, which is an encrypted messaging platform for physicians and other allied health. And he recognized that integration problem. And so he's working with 10 companies. We're included. We're lucky enough to be included. Essentially allowing us to get our data into the TELUS platform because they already have a presence there. And so he's kind of laid the foundation for that work.
Awesome.
And so that makes it easier for other startups in the ecosystem to get involved. And, as you can see, it's sort of a multiplying effect, right? You get somebody who's paving the way in one direction and then, it makes it easier for all of us. So
for sure.
Yeah.
And it makes life better for everyone as well, because again, this information is out there and it's potentially life-saving, information and life-saving platforms and programs that we need, especially in a time when we are coming into, cuts and budgetary restrictions and whatnot. We're always asked to do more with less, and things like this can be implemented and help alleviate. It's a great tool for this industry, for the health industry, and needs to really be fully embraced by everyone to get us to the next level and make sure that we are leaders, remain leaders in the healthcare industry. And then at some point, once we've kind of gotten this hammered down here, we can take that out into the rest of the world and start bringing it into international markets and be kind of like the foundation for it. And like you said earlier, being the leaders is super important, and we have all of that potential here.
What's really important for startups coming into the healthcare system in particular is it is a very complex ecosystem to navigate. As you can appreciate, healthcare data is quite sensitive. And we want to take all the precautions, to safeguard that. That being said, I think we want to support startups who are taking the risk and trying to create something novel to ultimately benefit patients. And I think really giving the tools to these startups and kind of maybe even some mentorship or, kind of helping them with that navigation process is really key. One of the things I've learned through the Hatch program is that if you as a startup, if you're dealing with healthcare sensitive information, and you position yourselves as being very kind of advanced in that area, that in itself can be like branding for your company, because large healthcare systems like AHS will want to work with you then.
Right.
Because oftentimes that's one of their biggest fears, that somehow in working with you, data could be compromised. And it's a legitimate fear, right? So one of the first things that you can take on as a healthcare company is to address that. But that's something that if you're going to go at it, having no knowledge whatsoever, that's challenging, right? Like, understanding all the laws, understanding all the policies in place. We have the Healthcare Information Act, we have PIPEDA, we have HIPAA down in the US. And so if you ever read those documents, they're overwhelming, right?
I can imagine.
So
pages.
Yeah, so one of the things through the Hatch program that we found is just having somebody who's already kind of laid that foundation and has come from that startup mentality. That has been tremendous for us in terms of time savings, in terms of just knowing the language to speak when we meet with AHS,
Yeah, I bet.
So yeah, I think things like that are really important. And I think having that, I think, the government putting money into place to support things like Hatch is absolutely essential.
Yeah. Yeah. Well, it takes a lot of the guesswork out for you guys too, because you're trying to focus on what you want to focus on. You want to be professional. You're a professional in this area of things, and that's what you want to focus on. And that's what you're delivering. But there's, unfortunately, when you're an entrepreneur, right? There's this massive circle of things you have to be a little bit good in, a little bit good here, a little bit good here, a little bit good there, right?
Yeah.
But when it comes to that kind of stuff, when it comes to that kind of technical end of things, you can't just be a little bit good. You got to be great or the best at it.
Yeah.
And like you said, like no one wants to attach themselves to you if they don't think that you have, that the level that they're expecting.
Yeah.
But if you can have those people like Hatch pulled in to kind of facilitate that part for you and make sure that everything is good and kosher and on the right path, so that you can continue to focus over here on what you're trying to get done, it just makes it. And again, it goes back to collaboration.
Yeah.
And we're starting to see a lot more collaboration. We just recently had Dyna Labs on here with their accelerator program.
Right.
Again, pulling in collaboration, because it's like, well, you're really good at that.
Yeah.
You're really good at that. But if we marry these two, and you can still be focused over here and focus over here, that marriage can make it that much more stronger. That's something that we need in all fields, whether it's health, whether it's oil and gas, whether it's politics, forbid, but but that's so it's great to hear that those kinds of programs are out there, and that there's more that there's always going to be a need for more to help more people get to the next level.
Exactly.
Like yourself. So that's super cool.
Yeah.
Right on. Well, thank you so much, Colin. This was super insightful. Again, just like last time, I know we talked a little bit more about the program on our last episode, so we'll definitely send people back to that episode to kind of get more in tune with what OpenXMed is. And then this is just great to get a follow-up from you and see where OpenXMed has gone, how it's growing, some of the potentials that are there, and just the future of something like this. Because again, I think it's really revolutionary, and we definitely need it. And it's great, again, to hear that it's coming out of Alberta. So
awesome, Bryce. Thanks so much for your time.
Thank you so much.
All right.
Awesome.
What that's called.